Good morning, everyone. Today I will show you a paper entitled Association of Serum Periostin Level with Classical bone turnover markers and bone mineral density in Shanghai Chinese postmenopausal women with osteoporosis. Osteoporosis is a systemic metabolic disease, mainly characterized by bone mass loss and microarchitectural deterioration of bone tissue, resulting in increased bone fragility and prone to bone fractures. However, bone mineral density and the traditional bone turnover markers currently in widespread use also have limitations to predict fracture risk. It has been reported that serum periostin levels are significantly higher in postmenopausal patients with osteoporotic fractures. Nonetheless, the levels of serum periostin in postmenopausal women with different bone mass remain unclear. Postmenopausal women were recruited in Community Health Service Center, Ganquan Street, Putuo District, Shanghai, from January 2017 to September 2018. According to the recommendation of the WHO, the participants were divided into three groups based on the BMDT score. The normal group, osteopenia group, and the osteoporosis group. We selected the lowest bone mineral density value among all measured sites as a value for diagnosis in every subject. The inclusion criteria of this study was as follows: menopausal for more than 1 year, the person lived in China for more than 10 years, the person signed informed consent. The exclusion criteria of this study were as follows: patients with a secondary osteoporosis, patients with a history of fractures, with diseases that could affect bone metabolism, who discontinued bisphosphonates for less than 1 year, and other medications that could affect bone metabolism for less than 6 months. The baseline characteristics of 311 postmenopausal participants are presented. There were no difference among the subgroups in age and menopausal age. Body weight and body mass index were significantly lower in the osteopenia group than in the normal group. In addition, the osteoporosis group had a statistically significant lower levels of height, weight, BMI than the normal group and the osteopenia group. As expected, the bone mineral density values at all menopausal sites in the osteopenia group. All the osteoporosis group was significantly decreased compared with the normal group. Consistently, the bone mineral densities of lumbar spine, femoral neck, and total hip were lower in the osteoporosis group than those in the osteopenia group. For serum periostin, no significant difference was observed between the normal group, the osteopenia group, and osteoporosis group. For bone formation markers, serum OC and P1OP levels in the osteopenia group were significantly higher than those in the normal group. Furthermore, serum BALP, OC, and P1AP levels in osteoporosis group were remarkably increased compared with those of both normal group and osteopenia group. For bone resorption markers, serum beta-6Tx level in the osteoporosis group was higher than those in the normal group and the osteopenia group. However, serum TREC P5B levels were not significantly different among the three groups. Our data indicated that low bone mineral density is associated with high bone turnover markers in postmenopausal women. Spearman correlations show that there were no significant association of serum periostin with traditional bone turnover markers, include OC, PRMP, beta-CTX, TRCP, 5B. In addition, circulating periostin concentration was not significantly associated with BMD bone mineral densities at all different sites. Bone formation markers such as BLP, OC, and P1OP, and bone resorption markers such as beta-CTX and TRCP5B were inversely correlated with the bone mineral matrix densities values in all different sites. Our OC curves show that serum OC and P1NP could better distinguish the postmenopausal patients from the non-postmenopausal osteoporosis subjects. So, we come to the conclusion that although periostin is highly expressed by osteoblasts and osteocytes, there were no significant correlations between serum periostin and the classic bone turnover markers or bone mineral densities at different sites, suggesting that serum periostin may not reflect the overall bone metabolism in Chinese postmenopausal women without prior fracture. In addition, serum P1NP and OC levels may be the predictors of osteoporosis occurrence in Chinese postmenopausal women. That's all. Thank you.